Hi, beautiful people. How are ya? I'm Dr. Pammy Jean. I hope you're having a great day. This video is for educational purposes only. Please consult your healthcare provider before making any changes to your healthcare plan. This video is not made for children, so please be advised and have your children leave the room. So this will be part one of 2 parts. But did you know that subscribing to this channel is free? I was talking to a friend of mine, and I learned that she thought there was a fee to subscribe to channels. And I said, no, it's free. Only if they ask you to be a member does it cost. So it's free to hit that subscribe button. If you like this content, it helps me a lot when you subscribe. And when I release new videos, you will be notified. Thank you, beautiful people. So today we're going to talk about lichen sclerosus, or LS, or more specifically, vulvar lichen sclerosus, VLS. This condition could be described as wicked because if treatment isn't achieved early, damage to a woman's most personal parts results in scarring and disfiguring. All of this is not because she did anything wrong. Men and children can get this too, but it's most common in postmenopausal women, although it can occur at any age. And lichen sclerosus can occur on other parts of the body as well. But for our discussion today, we'll learn what vulvar lichen sclerosus is and what causes it. Part 2 will provide additional information I'll explain at the end of this video. This is a very sensitive topic about a woman's most personal area, so it can be very difficult to talk about and very difficult to accept. So please be compassionate in the comment section. I was recently diagnosed with this, actually, the day after I recorded my last 2 videos. I'm still coming to grips with it. So please let me know that I'm not alone on this journey or that you're here with me. Here we go. Vulvar lichen sclerosus is an inflammatory chronic disease of the skin and mucosal surfaces. It's a lifelong chronic illness, but can go into remission. It involves the anus and genital skin and is not contagious. Urinary and sexual dysfunction may occur. Itching and soreness are common, but it can be asymptomatic, meaning no symptoms. It is believed to be an autoimmune condition, that it has a hormonal connection, and is most likely genetic. The main recognized pathophysiological events of vulvar lichen sclerosus, I'll just say VLS, are the following: autoimmunogenic mechanisms and subsequent inflammation and oxidative stress, and sclerotic tissue formation. Let's begin with the symptoms. Some people may be asymptomatic, as I said, making regular gynecology appointments necessary. However, potential intense itching and discomfort, such as burning and pain during intercourse, can cause a disruption in quality of life. And beyond the symptom of physical discomfort, the condition also disrupts vaginal health by weakening the vaginal barrier. So, to clarify, these are the common symptoms: pain from sex that can feel like stinging, burning, soreness, rawness, tenderness, aching, tearing, or in my case, it feels like razor blades tearing me up. Stinging while urinating is like pouring lemon juice on a paper cut. Pain or burning while sitting or standing, it can feel like stabbing pain or feel raw or tender, and clothing can aggravate this symptom. You may have general soreness and discomfort, causing you to be unaware of what is occurring. The signs. The first signs of VLS are usually a whitening of the genital skin, sometimes preceded by redness and edema, which is fluid retention that can cause a tightness in the skin in the vulvar and anal area. The vagina is usually spared. The condition involves thickening and raised, whitened areas on the skin, on the vulvar area, and sometimes tearing or bleeding can occur. The skin thickening can cause the skin to crack or fissure, even if you're not having sex. Vulvar skin needs to be mobile and flexible. Specific movements can cause the skin to crack and fissure. These fissures can be microscopic tears, and even though small, they can cause extreme pain. Over time, untreated VLS can lead to scarring, fusion of tissues where areas of the vulvar will fuse or stick together, and then may eventually make one part called resorption. The cause is not known, but there are triggering factors. Trauma and chronic irritation may lead to VLS. The response of specific lesions on normal appearing skin after trauma has been described in the Koebner Phenomenon. Mechanical factors such as friction due to tight clothing, sexual intercourse, tissue damage from childbirth, surgery, radiotherapy, or genital jewelry and piercing, and scars in general are known to be implicated in both development and maintenance of VLS lesions, again known as the Koebner phenomenon. It is the architecture of the skin that's affected. Post-inflammatory progressive scarring may cause irreversible subversion of the anogenital area, meaning the inclusion of the genital and anus areas, basically. Immunological dysreactivity and chronic inflammation, fibroblast growth and activity, as well as abnormal collagen synthesis, leads to a progressive formation of hyalinized and sclerotic dermal tissue. The gut and skin microbiome of VLS patients show dysbiosis or an imbalance of microorganisms in the gut, specifically the gastrointestinal tract, which begins in the mouth to the esophagus, stomach, and small and large intestines, and out the anus. But it also involves microorganisms in the skin. Here's the important part. Autoantibodies targeting extracellular matrix 1 protein and the basement membrane zone have been identified, and experts favor a T cell mediated pathogenesis, making this an autoimmune condition. I'm going to end part 1 here and discuss antibodies, metabolism, statins, prevalence, diagnosis, and treatment in part 2. So I hope you learned something. I send you gentle hugs and support. Love you.